Colon cancer symptoms versus hemorrhoids facts. Colon cancer is the growth of abnormal cells in the colon, large intestine. Hemorrhoids are swollen and enlarged veins in the lower part of the rectum and the anus. There are three types of hemorrhoids: internal, external, and thrombosed. Signs and symptoms of colon cancer and hemorrhoids that are similar include rectal bleeding, blood in the stool, the feeling as if you haven't finished a bowel movement. Colon cancer symptoms may not be noticeable until the disease has progressed. Signs and symptoms of colon cancer that do not occur with hemorrhoids may include changes in frequency of bowel movements, symptoms of bowel obstruction such as abdominal distention or pain, unexplained or persistent nausea or vomiting, unexplained weight loss, changes in stools, for example, narrow or ribbon-like stools, constipation, rarely, rectal pain. Causes of colon cancer include adenomatous polyps, genetic abnormalities, inflammatory bowel disease, a family history of colon cancer, obesity, smoking, and possibly diet. What is colon cancer? What does it look like? Colon cancer is the transformation of normal cells to abnormal cells in the colon. Most colon cancers are adenocarcinomas, tumors that develop from the glands lining the colon's inner wall. Sometimes colon cancer, or malignant tumors, are referred to as colorectal cancer, reflecting the fact that the rectum, the end portion of the colon, also can be affected. What are hemorrhoids? What do they look like? There are different types of hemorrhoids. Internal hemorrhoids are located on the inside lining of the rectum and cannot be felt unless they prolapse and push through the anus opening, causing pain and itching. External hemorrhoids are located beneath the skin on the outer aspect of the anus. Symptoms may include bleeding with a bowel movement and a mass or fullness that can be felt at the anal opening. A thrombosed external hemorrhoid occurs when blood within the blood vessel clots, and may cause significant pain and swelling. What are the differences between colon cancer and hemorrhoid symptoms and signs? People commonly attribute all rectal bleeding to hemorrhoids, thus preventing early diagnosis owing to lack of concern over bleeding hemorrhoids. Rectal bleeding may be hidden and chronic and may only show up as an iron deficiency anemia. Changes in bowel movement frequency. If the tumor gets large enough, it may completely or partially block your colon. You may notice the following symptoms of bowel obstruction. Abdominal pain. This is rare in colon cancer. One cause is tearing of the bowel. Leaking of bowel contents into the pelvis can cause inflammation and infection. Unexplained, persistent nausea or vomiting. Unexplained weight loss. Change in frequency or character of stool. Small caliber, narrow, or ribbon-like stools. Constipation. Rectal pain. Pain rarely occurs with colon cancer and usually indicates a bulky tumor in the rectum that may invade surrounding tissue after moving through the colon's submucosa. What causes colon cancer and hemorrhoids? Do hemorrhoids lead to colon cancer? People with certain genetic abnormalities develop what are known as familial adenomatous polyposis syndromes. Such people have a greater than normal risk of colorectal cancer. There are specific genetic abnormalities found in the two main forms of familial adenomatous polyposis. The cancer usually occurs before age 40 years. Adenomatous polyposis syndromes tend to run in families. Such cases are referred to as familial adenomatous polyposis, FAP. Other high-risk factors for developing colon cancers include any one of the following: ulcerative colitis or Crohn's colitis, breast, uterine, or ovarian cancer now or in the past. A family history of colon cancer. The risk of colon cancer increases 2 to 3 times for people with a first-degree relative, parent or sibling, with colon cancer. Other factors that may affect your risk of developing a colon cancer include diet. Whether diet plays a role in developing colon cancer remains under debate. Studies do indicate that exercise and a diet rich in fruits and vegetables can help prevent colon cancer. Obesity. Obesity has been identified as a risk factor for colon cancer. Smoking. Cigarette smoking has been definitely linked to a higher risk for colon cancer. Drug effects. Recent studies have suggested postmenopausal hormone estrogen replacement therapy may reduce colorectal cancer risk by 1/3. Patients with a certain gene that codes for high levels of the hormone called 15-PGDH may have their risk of colorectal cancer reduced by 1/2 with the use of aspirin. Causes of hemorrhoids. Hemorrhoids are not arteries or veins, but instead are normal blood vessels called sinusoids that are located in the walls that surround the rectum and anus. When the venous pressure within these blood vessels increases, the hemorrhoids swell and dilate. because it is more difficult for blood to empty from them. This leads to the most common symptoms of bleeding and swelling. Common situations that increase pressure within the hemorrhoidal blood vessels and lead to abnormalities include colon cancers, straining to have a bowel movement. This may be due to constipation or diarrhea, prolonged sitting, including on the toilet, lack of exercise, low fiber diet, obesity, pregnancy, liver disease, inflammatory bowel disease, anal intercourse, spinal cord injury. What should I do if I have signs and symptoms of colon cancer or hemorrhoids? If you have any of these symptoms, call a doctor. Bright red blood on the toilet paper, in the toilet bowl, or in your stool when you have a bowel movement. Change in the character or frequency of your bowel movements. Sensation of incomplete evacuation after a bowel movement. Unexplained or persistent abdominal pain or distention. Unexplained weight loss. Unexplained, persistent nausea or vomiting. Large amounts of bleeding from your rectum, especially if associated with sudden weakness or dizziness. Unexplained severe pain in your belly or pelvis, groin area. When to call the doctor for hemorrhoid symptoms and signs. If you have rectal bleeding or blood in your stool, call a doctor. Other causes of rectal bleeding exist and can be serious. Inflammatory bowel disease and cancers of the colon can cause with rectal bleeding. Blood in the stool should never be ignored. People who have associated symptoms such as lightheadedness and weakness may have significant blood loss and may require more urgent care. Abdominal pain. Hemorrhoids do not cause abdominal pain. Prolapsed hemorrhoids that cannot be pushed back through the anus. Thrombosed external hemorrhoids may cause significant pain, and a doctor may need to remove the clot. If you suffer from hemorrhoids, and you tried everything, let me tell you a quick story about my friend Lisa, who suffered from severe hemorrhoids along with constipation and IBS. She was a very bright mid-20s woman yet unemployed because of her condition. She was practically living on drugs, creams and over-the-counters, and was at one point in dire need of reassurance and help. I changed her name for privacy. Lisa was treated by 4 different doctors who advised her to keep taking the drugs and apply the prescribed creams. She had followed this 5-step plan with some restrictions and limitations. She learned how to reverse her condition by following the same approach you're about to learn. Lisa committed herself to following the program. In less than 2 weeks, Lisa's hemorrhoids had disappeared along with the IBS and constipation. For Lisa, it was a life-changing experience. This program is a proven system for men and women around the world. Everything Lisa learned and discovered from this research and program is immediately available to you through this 5-step Hemorrhoid No More program. If you want to find out more about this program, click the link below this video. Lisa was able to cure and prevent all future hemorrhoids in less than 2 weeks after she followed this proven 5-step system, so can you. Click the link below and start now.